welcome to the Happy Mum, Happy Baby, the virtual meetup. I am Emma Willis and I'm absolutely delighted to be joining you guys and helping G out this year and hopefully having a really informative chat about all things pregnancy and childbirth. The last year has been crazy, to say the absolute least, for everybody, but I would imagine those people experiencing childbirth and pregnancy for the first time, you must be all over the place, even more so. So I'm delighted to be joined by Gloria and Anna. Hi, ladies.
Hi. Sorry, the mute button was too far. I didn't have the cursor ready. Sorry, my bad. I'll be better. Hi, Emma.
How are you?
We're good, thank you. Yeah, you?
Yeah, really good, thank you. For those watching and that don't know, for the past couple of years, I have worked on a show called Emma Willis, Delivering Babies, and I've had the absolute pleasure of going and working alongside the wonderful staff at the Princess Alexandra Hospital in Harlow in Essex. And that is exactly where Gloria and Anna are joining us from right now. So you are on shift. We have pulled you away from your very important work, helping ladies during pregnancy and birth.
Yeah, I mean, I was teaching this morning, so I wasn't rostered on to work clinically.
Yeah.
So my job's a bit of a mixture between the two, clinical and then like teaching and training development. So yeah, I've escaped.
You escaped.
I've escaped to come and do this.
This is your cup of tea time, basically. You've given it up to come.
Yeah.
People have sent questions in that are desperate for you to answer. Before we get to that point, can you just fill us in on what it has been like for you guys on the ward for the past year during COVID? And maybe explain the roles that you do within the hospital as well.
So I work on labour ward. I'm one of the labour ward coordinators, and since June last year, I became the labour ward manager. So I still do shift work, which is always fun. But last year, obviously, it's been really difficult, but challenging. But you know, we're a team, we're a family. We've worked really, really hard together to make sure that we're still providing excellent services to the women and families that use our services. And really, it's just been amazing this last year how we've come up against kind of like the whole pandemic that is COVID, working together, making friendships for life really here, because we know how we care so much about each other and for the women that we look after.
Yeah.
So yeah.
And what about kind of the day-to-day workings of the ward? How, obviously, everything has changed for everybody everywhere during the last year, but particularly on labour wards, well, not just labour ward, but particularly on a maternity unit, what changes had to be made?
I think there was quite a lot of strategic planning in the beginning. We didn't really know a lot about COVID, what it was, how it was going to escalate. So preparing for, hospitals have had, COVID areas and non-COVID areas, trying to split a whole maternity unit that already has designated ward areas into then like a COVID antenatal, non-COVID antenatal, COVID intrapartum, non-COVID intrapartum, COVID theatre, non-COVID theatre. That was always going to be really problematic, particularly looking at the layout of the unit that we have in Harlow. Different units have like advantages, disadvantages. Some have great big lecture theatres, or different floors, or that you can sort of split things, but where you've got one corridor and two theatres, you've got to be quite creative with how you're going to try and keep everyone as safe as possible and create new areas and new ways of doing things and walkie-talkie systems and all of that stuff. But I think everyone was, came together to try and work it out, because we were aware that no one really knew the answer, because you'd never come up against anything like that before. So that was strange. But once we kind of got into a bit of a flow with that, and then the PPE was a change. and having that. But yeah, so you feel a bit like a stormtrooper, you know, at the birth now when you go in and you've got your gown and your mask and your visor and you know, everything. It's a lot, but you've kind of got used to it now, to the point that it just feels quite strange if you haven't got stuff on.
It's kind of one of those things, you know, I'm not sure if you've seen it, where people say, can you believe that we did this a year, 18 months ago, blowing on candles on a cake? Now it's very alien for us not to wear PPE, not to have masks, not to, you know, things that we may have slipped up before in the past, not wearing certain equipment. This is now you're instilled. It's, you know, it's your basics, and that's what we use all the time now when we've got patient care.
Yeah, it felt a bit strange, I think, with because midwifery is quite, you know, you're very close to the women that you might, especially me, myself and Joy both work in like an intrapartum setting, like primarily. We could work on the other areas, but you're used to kind of, you build that relationship really quickly with the family, and then, you know, whether you're very tactile as well. So when you first had to, you know, put on an apron and gloves just to palpate, you know, the ladies, like Tammy, that felt very like you were almost saying that they were dirty by putting something on. It felt really clinical and not very nice. There was a barrier that was there. Yeah. That has, I guess, for us, that's become normal because we're really used to doing it. But I guess for the women, perhaps that might still feel a bit odd, you know, that we do that, particularly with previous births, like what they've sort of experienced. I mean, we always wore gloves, you know, like when you're changing pads and stuff, like that's not changed. That would be gross. But yeah, I guess that difference in experience, if they've had a baby before, or if, you know, with what to expect and stuff, has probably been quite different.
Yeah. And have you found that the women coming in are more nervous than they necessarily may be because of COVID? Or do you think people are, I mean, we're a year in now, do you think people are women adapting quite well?
I think they have. I think the beginning of last year, I think there was so much unknown, especially in pregnancy, that a lot of women may have been quite fearful to actually attend the services that they required. So from my own experience, definitely there was less people coming into the unit for something that they may have just been worried about. But, you know, we're a 24/7 service, so we expect phone calls at 3 o'clock in the morning. If you've got a concern about baby's movements, you know, we will always invite you in to come in. So that was quite strange, and it did make you think like, oh, that's really weird that it's a lot quiet, and we don't like using the Q word on labour ward.
Yeah, we don't.
So despite everything that was happening outside of the doors of labour ward, we were quite calm the first few months. But now it's things back to, this is our new normal. The masks are normal, the PPE is normal, and the way that we do things, this is how we do it now.
Right.
Yeah, I think if women have come into antenatal appointments and they've seen people wearing that stuff, you know, they've been in the setting, and that then it's not as alien when you're coming in. You know, if you happen to be that poor family that when we initially started doing everything, that was the time that you were coming in, it probably really was quite alien. Scary, quite scary for them. I
spoke to Jackie last summer, and I was kind of asking what it was like, and she said, you know, it's just like nothing we've ever known. Like everything has changed, and she said the one thing that she really noticed though, that the wards were different because the women had their curtains open and they were talking to each other, and you know, because you can't have partners there constantly, they were communicating with each other and supporting each other. And she said it was like going back in time, like 30-40 years. And she said it was, you know, as much as it was, you know, people struggled because they wanted to have their partner there, she said it was really lovely to see these women kind of engaging with each other and supporting each other rather than kind of having their curtains shut, being on their phone. They were just, everything was open.
Yeah, definitely. We noticed that on the wards. I mean, it is, so we haven't been able to have you know, like with visiting and stuff like that, on the antenatal postnatal was with social distancing, like to be able to social distance properly. That's what the kind of difficulty has been with that. But it has meant, that women have been having their curtains open more, been talking to each other. They look for each other on the postnatal ward after they've had their babies. You know, they're exchanging numbers. You've kind of got this little weird period of contact with people that you've not had, because the rest of the time you've just been stuck in your house. So you're kind of in this bay with other women, like, and you can all talk about pregnancy and you know what's going on for you and everything together, which has been
they've been going through similar journeys, I suppose, especially from the antenatal ward if they've had inductions. So they'll know that this lady across me has had a prostate, this one's had a Cook's balloon, my waters are going to be broken, and so they kind of then make that friendship in a bubble, and then go through labour, obviously in a separate journey, but then try and meet up in the postnatal ward, which is lovely. And so with the curtains being open, you know, you compare your babies, you compare your journeys, you talk about how things have been, you know, good or bad, but then you're talking, you're communicating, and that is lovely for them to do.
Yeah, and it's not that they couldn't do it before. It's just that I think the temptation when you have your own visiting, you know, people and that coming in, is that then you just keep your curtains round and you're in that little bubble on your own, and you don't necessarily, you're not kind of prompted or kind of a bit forced, if you like, not forced to talk to people, but there's kind of that incentive is there that you think, oh, there's people there that I can talk to, they're in the same boat as me. And then it's nice when you sort of collect someone to go over to the labour ward or something, and they were like, oh, good luck, and you know, let us know how you get on, and all that's great. They're all kind of looking out for each other, so that is really lovely.
Yeah, that must be quite nice, because I don't know, but there's no NCT classes happening, right, unless they're virtually, I'd imagine. And as much as it is lovely to talk to people and have communication this way, nothing beats being in person with people and sharing experiences, does it? So that must be a little kind of touch of what they're missing when they get on the ward with you guys.
So I think that's fair. And they're doing like online ones, and then a lot of the teams have converted as well, like the midwifery teams are doing their own like workshops and stuff for the women. And there's, you know, whether you're doing something that's private or NHS or whatever, that is kind of available, but like you said, it's not, you know, it's not in person. It's a bit like our escape as well. I was saying for to come to work, because we get to see our friends. So we've been really lucky.
Our lives haven't, like for me, in fact, our lives haven't changed. We still come to work, and then we go home to our families, and then we come to work, because, you know, if we're not at work, we're usually with our families, and then we're usually together. So it's just nice that we've been able to continue that, despite so much that has been lost in the last year.
Has COVID made much difference on birth plans or birth prep sheets?
I think there's been definitely changes in preferences of maybe birthing at home. That the fear of obviously coming into hospital, or the restrictions of birthing partners, and in terms of facilities. So maybe if, you know, staffing issues due to self-isolation, sickness, your birthing unit is not open and you want to pool birth. So issues like that surrounding it, that have affected, definitely COVID has affected that. But usually your birth plan or preferences really is looking at what your feelings are surrounding birth and how you are wanting that journey to go. And really for us as midwives is so that we're aware of what your feelings are on these issues, but how we can support you and give you the information so you make that choice that's been informed, and you're happy with your understanding of the options that have been given to you.
Yeah, I mean, obviously shielding sickness, people having COVID, staffing like that, that's had an impact in every job, every kind of service that's provided. But the actual birth plan that women make, and with them, then probably not that much.
Okay. We've had so many questions in for you. Shall we stop gossiping? And so people really want the answers to.
We'll try.
Here goes. First one, what should I pack in my hospital bag? I remember when I packed mine, it was like I was going to hospital for a month. I think because with your first time, you don't want to have too little. I didn't want to have too much, but then I didn't want to be caught short. So I'm always I'm much more of an overpacker. So I suppose, what's a realistic amount as well? And what do you find, sorry, this is 3 questions in one now. What do you find is the most unnecessary thing that people pack?
So in terms of quantity, I personally, I mean, we've all seen it. There'll be like one suitcase for mum, the other suitcase for baby, and dad got another bag, and they've got the car seat already in before mum's in labour, kind of thing. And you think, whoa, that's a bit too much. I think really it's depending on what type of birth, because if you are having, let's say, an elective cesarean section, and you may know that you may need to stay in for a couple of nights, 2 or 3 nights, then you definitely will need more than, let's say, if you're planning just to come to use the birthing centre, hoping to maybe get discharged in 6 hours. Obviously, you're never going to know how things plan out. But I kind of think get your necessities. So obviously a pack of nappies, your vests, your sleep suits. For me, muslins are the best thing ever in the world.
You use them for everything.
You use them for everything. I think they're just brilliant, really. And 3 to 4. And then I've seen really lovely like mums that bring in like little Ziploc bags of like the first outfit for baby. So there's a nappy, there's the hat, there's a sleep suit, the vest, and it's all there. So it just makes it easy for dad that when he's rummaging through this bag that he's not packed, that they can quickly get it out and give it to us, when we're ready to get baby dressed.
Yeah, because you always have that.
Yeah.
I packed it and they're like, it's not in there. And they're like, yeah, I packed it. It's in the front pocket. And it's like, it's not in the front pocket. And then they're like, getting all like cross each other. So it's like, it's probably your birth partner that's going to have to that's going to be getting the stuff out of the bag. So it's a good idea for the birth partner to know where stuff is in the bag that you're going to want.
A vest, a baby grow, a muslin in a Ziploc bag, so that your partner can just whip it out quickly for the imminent birth, and then everything else is just kept.
I don't think you need to pack into excess, really, because we're really lucky that obviously we've got 24-hour shops, petrol stations that have anything that you need, you can pop out, and it's so easily accessible. You've got online services that deliver next day. I don't think there's anything that you need to be thinking, oh, we need it right there and then. And sometimes it's things that you've not even thought about that you can get at last minute. But obviously things that mean something to you. So obviously that lovely little blanket that's been gifted to you, a lovely little going home outfit, that's what you want baby to wear. But really, it's all the little...
Yeah, stuff like that. I mean, I'd have stuff at home kind of almost like in a grab bag. So if you were maybe staying a couple of extra days or something, they'd be able to just pick that up rather than you thinking, oh, I want the top that's in the wardrobe by the, like explaining bits that you want, something comfortable to wear afterwards that's actually going to be comfortable. Really big pants.
Yes.
Really, really big, huge pants that you'll never stop wearing.
Pants and tracksuit bottoms.
Yeah. So really, really big pants, pads, huge pads, and then
tops.
Yeah, something that's going to be easy for like skin to skin when you've had babies. So think about what you might like to wear when you're having your baby, or if you want to wear anything at all, but something that's like easily. Sometimes you're trying to take this off and it's got like 4 straps going round and then like a bra strap here, and then your birth partner wants to do skin to skin, and that's great, but they're wearing like a really high neck top and they're feeling a little bit like, oh, maybe they didn't want to strip their top off or something. So just think about it, like maybe have a shirt that you can just undo a bit and slot the baby in. Like how comfortable will you be, and then make it so that you're going to be as comfortable as possible doing what you want to do. Like the plan is for my partner to have skin to skin. and he's happy to strip off and be bundled in towels, and that's fine. Or actually he'd rather just wear something that we can slot the baby down into or something. So think about that sort of stuff for you. Yeah.
And don't forget snacks.
Yeah, food.
I like what you just said about the little grab bag. Rather than overpacking, have a backup bag at home that is easy to get if you end up staying in longer. That's a really good idea.
Thanks for paying that.
What's the most useless item that people pack?
The book of crosswords. No, I don't think anyone ever does them. But like the magazines, I usually a lot of women would like leave magazines, like then like, oh, if anyone else, you know, had wanted them or something.
Obviously, I have seen people try and bring the big maternity pillows, like those massive ones. But I think once you've taken through that journey from the antenatal and then maybe onto the labour ward and then the postnatal period, dragging around this big, you know, massive little pillow that just gets dragged on the floor and things like that, I think obviously that becomes quite cumbersome for mum and dads to be carrying around the unit. But
car seat is probably the most useless thing to take into a delivery room. Yeah.
Before the baby's even out, the car seat can stay in the car until it's actually needed.
So leave your comfy pillow and your car seat until you actually need them.
I mean, definitely bring a pillow because they're always helpful.
Your big wraparound.
Yeah, those really, really big ones.
Yeah. Okay, great. So lots of questions about birth plans. People want to know, do you literally write it, or is there a form, or is it a discussion that you have ahead of your birth with your midwives? And do you have to have one?
You don't have to have one at all. It's not like it's like a requirement when you come in. We talk about this a lot. So we see it more as like birth thoughts or like birth ideas, preferences, things that you've thought about. And the aim of the birth plan is to get you as informed as possible and to help you make choices that you're going to be really happy with. And that's the way that you would like to have your birth, or will feel supported in having had that information. So then when you're in the situation, you can utilize that to make decisions that are best for you. The problem, I think, with having a really prescriptive birth plan is sometimes if it hasn't quite gone to plan, that feeling of failure and having not got the birth that you wanted, that can be tricky. So I think if you see it as, and not to say that we're just, write a birth plan, but then we're going to disregard it and you have to go along with everything that, people in a hospital say, that it's not the case, but your birth plan might be quite different to the situation you then find yourself in, based in kind of what's happened in your, the later part of your pregnancy and your labour. So you kind of need to be able to take on board new information. But if you feel a bit clued up about it, you'll find it a bit easier. Like maybe if you've read up on and discussed with your midwife about your analgesia options, so you feel like you're kind of aware of maybe some risks and advantages, disadvantages of an epidural, then when you're in the situation that you think, okay, epidural is the common one, isn't it? So you think, so I've decided I don't want to have an epidural. And then when you're in labour and you go, I really want an epidural. And someone says, oh, you said absolutely don't let you have the epidural. And just like, I really want the epidural, because, and the thing is it's good to be reminded of what your preference was, but also you made that preference when you worked in labour. You so you need to remember what you thought before, but take on board how you're feeling now, and not just, oh yeah, we'll now have one. Like your midwives and thing will absolutely support you in, you might be in transition or you're just in, and we're kind of picking up on that and working out what's, best for you. But if you've really changed your mind and you really want one, that we're not going to be like, no, it's not in your birth plan. You can't have one.
Your birth plan really just gives us and everybody in the room the opportunity to really know where you're kind of like starting off labour, where your thoughts are. And if you are unsure, that's why when I love doing birth plans if my mum hasn't done one before, So at the beginning of labour, when she might not be too distressed or too in the zone, that we can just have that quick discussion of how did she think she wanted birth to be like. Because there's such little things that she may not have thought about in terms of third stage of labour. Does she want to do anything with the placenta? Does she want to hold on to baby straight away? Or does she want the birthing partner to be holding baby? The sex of the baby, who is going to announce it? Because those kind of little bits I don't want to take away from the family. Just because I might be the first person to see the sex of the baby, it might be lovely for dad or even for mum to be able to do that, to cut the cord themselves. So it's all those little bits that you may just you want to kind of tease out, which can be brilliant if they can be done before labour starts, but they can be done at any point during labour, because obviously your preferences and changes are going to occur. Yeah. When you get more information, and if you're aware of all the possibilities, then at least then it's not frightening when that information has been given to you.
Okay, so you can write one if you want to, but you don't have to. You can have a discussion if you want to. You don't have to have one if you don't want to. And it's good to have a plan, but I would imagine it's also good to be adaptable.
Yes. Yeah.
I think
adaptable is probably the best word. Yeah.
Being adaptable, keeping in mind, and no one's ever going out just to ruin your birth plan. Like, that's not why people became midwives, maternity support workers. Obstetricians was not to ruin birth. It was to facilitate it and champion women, and and be there for them. But I do think it is good. Some people say, "Oh, I'd rather not know. I haven't looked into it. I haven't done classes. I haven't done things. So I'd just rather not know." And if that works for them, then that's fine. But I do think it's a good idea to have read up on some stuff and have been able to discuss it with midwives. So then when someone says to you, you happy with vitamin K? You're not like thinking, oh, it's just like this barrage of information. Or like Gloria said, if you haven't been able to have that conversation early on in labour when you're kind of still chatty and you're completely in the zone and you've got someone going like, do you want vitamin K? You'd be like, what are you on? Like, why are you asking me this? I'm like, do you want to know the sex of the baby? Like, you don't want someone talking to you. Like, they need to pick up on when it's appropriate to have those conversations, and then to discuss that as well with your birth partner, because I think that comes as a big shock to a lot of people, actually, because at the beginning women are usually quite chatty and then they go quite quiet, and it's almost like that, oh, what's happening, or she's not, like, what's wrong, or something. So, nothing's wrong, like, we're quite excited now, she's gonna have the baby. And
it's knowing the role of your partner, like Hannah said, because some birthing partners are really in it. They want to watch everything, see everything, discuss everything, and some partners just there, just physically there, and they might want to take a step back, and we don't want to be trying to force them to get too involved when they know in their mind that they're fine, we're good. So it's supporting them as well. And so if we know what kind of birthing partner they're going to be, we'll involve them as much and kind of tease some of the bits that we think are really important. Because
not push it.
Push it, because we never want somebody to be uncomfortable. Oh, they made me do this.
Yeah. Somebody like, look at it. Look at what's happening. Okay. What breastfeeding support will currently be offered to me in hospital? Does it differ from trust to trust and from unit to unit?
It shouldn't. It really, really shouldn't. All midwives, all maternity support workers, midwifery care support workers, they have all done the same training, which is yearly, which is updated. We adhere to standards on supporting breastfeeding, and really, if that's something that you decided to do yourself for your newborn baby, then we will support you as much as you need, as much as you want. And the buzzer, the call bell will always be there for you. And we initiate it from the off. Once baby is born, we encourage skin to skin, the first hour following birth. We don't interrupt you, as long as you and mum and baby are clinically well, just to allow you, baby and birthing partner, to bond in that time. So really, we get that from that point, then really that's just a lovely start to to breastfeeding.
Yeah, I remember when I was there, it was one of my favourite things to do. Was if a woman was struggling with breastfeeding, was to try and help her, because I struggled so much with all three of mine, and I really, really wanted to do it, and I really wanted it to just be a totally natural thing that happened, and it wasn't. It was a struggle from beginning to end. So when I was there with you guys, and I would see a woman struggling with a latch or position or something, I was kind of willing her along, and I felt like, even though I couldn't do it myself, I totally understood how to assist someone to do it. And there are, as you just said, there's plenty of people on the ward, aren't there, that are trained and can assist. If you are struggling, you should always ask for help and not just assume that it's right.
Yeah, you're not like rushed home. Like we kind of, the aim is for you to go home when you're happy, you can control any pain relief that you might need with stuff that you can use at home, and you're happy with your baby care and feeding, your baby. I don't know, there is something really lovely about when you've been able to spend that time with someone, with the feeding, but it can sometimes be a bit of a information overload. When you've just given birth and you're in that bubble and you've done that, had that skin to skin time and your adrenaline's kind of thing, and then you're in that, oh my gosh, my baby's 2 hours old already, or, and it's just flown by really quickly, and then you're helping with the first feed, and then you're giving all this information, because we have to give it over antenatally, but then intrapartum as well, about, so this is how you recognise signs of good attachment, and this is this, and this is that. And sometimes you can see the poor woman sitting there thinking like, yeah, okay, right, I'm like taking notes, like I wish I was like recording what you're saying, and you think, oh, I can't not say it, but then it is a bit, so I think it's about signposting, isn't it? And we said, like, oh, there's the breastfeeding hub app, or there's, all of these services that are available, and then you can break it down into smaller chunks, so like reread it later when you like jog your memory about, when she said about that, I can look at this.
I think it's really important taking the feed at a time. I think if you, like one of my things, because personally myself, and whenever I see a mum that they hunched up trying to get that baby this new thing, and it's like, just bring those shoulders down, take a deep breath. And like you say with yourself, Emma, it seems so natural, but the barriers, and they seem to get higher and higher, and it always seems to be something else that it just doesn't feel right sometimes to breastfeed, or it's too painful, or it's sore, or baby doesn't stay long enough, or stays too long. And those kind of issues are really, really hard to break down when it's something that you really want to do. And so it's just really get as much support as you can. And I think just don't hesitate to ask, and don't feel like that feed didn't go right, so I failed, so I need to do something else, or I can't fix it, because it's just literally one feed at a time. And then when those feeds get a little bit better, by the third, fourth, fifth feed, then hopefully we've kind of managed it, and the expectations are also a little bit lower, so you're not putting so much pressure on yourself. Because I know personally, and I've seen it before, that it is such a hard thing to do. And sometimes it's that expectation by the third baby, I was able to do it. Yeah. And even then I still question if I did it right, but I did it.
Yeah, the pressure that mums put on themselves. From a totally different point of view, do hospitals provide formula if I need it, or should I pack some?
So if you're planning on formula feeding your baby, then you should bring the formula that you want to use. So you should bring what you would like. If you're planning on breastfeeding your baby, then don't bring formula with you. So if you're planning on doing it, then you should bring it. The hospital won't be providing it. But if you're planning on breastfeeding, then you don't need to bring anything with you.
Okay.
Mm-hmm.
Are pool births okay and advised during COVID times?
Yeah.
It's fine.
So we should have said, like, you do this one, I'll do this one, you do this one.
There's no, unless there's any other reason, medical reason, or you've been advised against it, using the pool during labour and for birth is great. We really do encourage it. If the hospital that you're booked at have the facilities, then definitely go for it. But really, that's something that within your birth plan or in the discussion when you get admitted into the unit, if it's something that you want to use, then definitely. But there are no restrictions in regards to COVID.
Is there a recommended time period between having babies?
Oh, like 15 years. I don't know. No, but so the only occasion that maybe possibly if you've had a cesarean section, then your obstetrician will have a debrief afterwards, allowing that your plan for an elective or for if you had an emergency, and they will talk to you about the surgery and give you like recommendations about what, like, if you should wait a year or so, like between having babies. But following, a vaginal delivery, that's just up to you. It's personal.
It's really how you're feeling physically, mentally, if you feel that you're ready for another child so soon. Some mums would run a hill before they'd get pregnant again, but some mums, they want babies close together and get, their babies kind of all done, dusted, and see them, which is great. And it's really what suits your family. And if you feel that you can physically handle it, and as long as there's really no medical conditions that could impact on it, I can only think of something like maybe heart conditions, kidney conditions, something that obviously you need medical input, and they might say, hang on, let's give your body a bit of time to recover before we do it again. But
if that was the case, you'd be under a specialist for whatever your condition was anyway, and then I'd just say just discuss it with them.
Right. Just touching on something you've just said, actually, because there's been so many questions from people wanting to know, can I have a vaginal birth after a planned or an emergency section?
So yes. So definitely yes. If it's something that with the discussions with your midwife, you may be referred to a birth options clinic that might be run by a consultant midwife or a consultant obstetrician, and they will discuss what happened at your previous birth and how that went, how the recovery was. As long as there's no long-lasting complications, there's no other issues, then there's no reason why a successful vaginal birth is not a great way to attempt that. You're looking at the stats of something over 70% of mums that try to have a vaginal birth after cesarean section are successful with it. There is obviously the fear that you might encounter a uterine rupture, which would be an emergency if that were to happen. But then that's where the recommendations would be that you would birth in a consultant-led unit, so you'd be close to the team of obstetricians and anaesthetists, your senior midwifery team, to ensure the safe delivery of you and baby, really.
Yeah, and your monitoring is slightly different. The way we listen to baby's heartbeat, I will recommend listening to that, is slightly different if you've had a cesarean section before. But it's all about with like perception on risk and things, and chance of something happening, and so for you in your circumstance, if you had an otherwise uncomplicated pregnancy, and perhaps you had an emergency cesarean in your first birth because or an elective for breech on your first birth or something, but you were otherwise all low risk, and then this time you've got no complex medical history, just that you had your previous cesarean, your baby's not breached this time, that's what you've decided to do last time, but this time baby's cephalic and you thought, I want to try for vaginal delivery, and then they talk to you about risk, and for you feel like, that 1 in 200 chance of my uterus having a rupture, for me actually that's an acceptable chance, and I want to do that because I'd really like to have the vaginal birth. But for another woman who has a big complex medical history with lots of other bits going on and different risk factors, might think, actually for me I would rather have a planned cesarean section this time, or I'm not sure how I feel about it, I really want to discuss it in more detail with a consultant midwife and a consultant obstetrician, and a birth reflection service with the midwife to discuss your previous birth, because that's often a lot of women that go to the birth options clinic to discuss like subsequent birth will then go back to discuss their first birth, because you can unpick a lot from that to help them make that, plan for what they want to do with this birth. Because I think a lot of people haven't worked through that. That's a big thing, working through the first birth to then decide what you want to do for the second, with all that kind of.
And birth reflection it's massively important, isn't it?
Definitely. I think you don't realise, even, we're both qualified professionals. We've been doing this for a number of years now, and we talk about our own births and we debrief each other. So, we're able to do that, quite rationalise it. But, we're friends, so we've got the emotional connection. So we understand it in a friendship level. And, there's so many different layers. The expectations that you had, the expectations you feel that your family had, how did the birth actually go, what were your expectations from midwives or doctors at the time of your birth, the journey of labour and birth, and why it ended up happening, that situation that makes you, because I can only think of the word as kind of sadness, that you didn't achieve what you wanted to achieve, or post-birth, what emergency happened at that point, and trying to understand and unpick each thread, and kind of like going backwards and going, okay, this is the point. So everything from that point, actually, it was great. And then at this point, something happened that maybe shouldn't have happened, or could have been different, or the information should have been relayed to you better, for you to understand the events that followed. Because for us, it's we can, in hindsight, or say, oh yeah, we knew that was going to happen, or be prepared, but because we don't communicate it well, because obviously we don't want to, probably a bit of fear, because we always want to kind of be quite happy and positive that things are going to work out. For us, it's sometimes we know that things might not work to plan, and then we have hope that, that things might still do, but then they might not. And then obviously for you, it's a shock, but for us, it might have happened. We were maybe a bit more clued up that it might have happened that way. And so I feel like birth reflections gives opportunities for a lot of mums, new mums, their birthing partners, their families, to have a better understanding of what happened, because it takes that perspective away from them as well. Yeah. Because I think we all know that kind of feeling that, you can look at the clock and it's only been 5 minutes, and then look at it 10 minutes later and it's been an hour, and you kind of think, what happened in that time? But you can only remember those last 10 minutes.
Yeah. But
you remember them vividly. You remembered certain points of your labour. And it's kind of like, well, actually, in that hour, so much happened.
And then what happened and why it happened, and then being able to, unpick what might have led, to that, and understand what happened a bit better. Because even if you were told, or it was discussed with you, I mean, when you're in labour and birth, like your hormones and your, we know that you're not rationally thinking, right? We know that you're not engaging that part of your brain. That's the whole point, that you switch that bit off and kind of go into this, like, in a, sort of introvert kind of state. So then expecting you to make really rational decisions and completely comprehend everything that's going on is a really big ask. So to be able to go back and discuss that and look at what's happened before, and then kind of work through what you'd really like to do, because then you're more informed as well, aren't you? Because you really understand why what happened, and what that might mean for the future.
Yeah, for the future.
Is it a relatively new thing? Because I was just never aware of it, and until I came and worked with you guys, and I actually then had it for my first birth with you. I didn't even know it existed, really. I mean, I'd obviously heard about it when I got to you, but I feel like when I had my first two kids, I wasn't ever really aware of that being a thing. And I had quite a traumatic first birth, but just never really thought about it, never really talked about it, never addressed it. I just put it down to, well, that can happen. And it just so happened to happen to me. And then when I came to the hospital and worked with you, I was in theatre watching a repair, and I passed out. I don't know if you remember. Because and then after that, we talked about my first birth, and it had been similar to what I'd watched, and I think that was what made me hit the deck. And I was given birth reflection with you, and I think it made a massive difference. And then my next challenge was to see another repair and not pass out, and I didn't, so I felt like I'd achieved. But I think it's very easy to just kind of go, well, it's birth and it happens, and that's what happened to me, and I've just got to deal with it. But you don't just have to deal with it, do you? You don't have to sit with it in you and never address it. You must address it, you must talk about it and acknowledge it and understand what happened to your body.
Yeah, I think that's really the most important thing, is understanding that that all these things that were happening, because obviously it feels like everything's been done to you without you having a voice. And you not knowing exactly why that happened. And I think if from the other side, when you kind of flip on its back and go, okay, well, these are what the notes say, then you kind of have a better understanding. It might not make you feel any better, but at least it kind of clears it and defines it for you that bit better, and that you have a better understanding of the whole scenario. It might not give you all the answers that you need, but at least it's kind of in a really non-judged, it's not rushed, it's not like, come on, let's talk about it. Because I think sometimes the fear is a lot of mums would get to debrief when they tell their birth stories at home or to their friends, and you only ever hear the horror stories, don't we? And I think that's when we did that, because we only ever told the bad stuff. This happened to me, they did this big cut, baby was pulled out, that kind of horrible stories that you used to hear. And I feel like we hear less of them, because I think mums have been given the opportunity to actually talk to them, to the people that gave them the care, that provided them the care. And I think we can balance it out with more positive birth stories, with the ones that obviously may not so much. But
yeah, and you can digest it then because you're, discussing it. I mean, I think each unit does it a bit differently. Our midwife that does it here in Harlow, she goes through the notes, we'll arrange the appointment with you, and then she'll discuss, read through the notes beforehand and take on board anything particular that you wanted to go through, and then be able to go through and discuss them with you. So it puts it into context, because you can ask for your notes and that's fine, but sometimes the shorthand terms or the way we write things, or that happened and that would have been because of that, or that is in midwifery, this is what happens when this happens, or this is what we're thinking might happen next, and that is why they will have offered you this, and you should always, in your notes, like you see, we write so much, you're documenting what you did and when you did it, to the minute, and your rationale for your actions and the evidence behind it. But when you're trying to do all of that and provide patient care, it is tricky. So you write absolutely as much as you can, but it's not an essay, so I think it does with references, so it does help to have a midwife to be able to go through to go through that with you. And it absolutely doesn't take away from your experience of it, because you might have a normal vaginal delivery and be traumatized by it, and you might have an emergency cesarean section running down the corridor one and actually feel like you've had a really positive experience and be really happy with your care. So it's about being really better as birth people, birth workers, about making sure that we're really communicating with women, and we have that in all of our training in emergencies as well. It's focused around communication and stuff, but sometimes it's going to go a bit squiffy, and if you're that person that's then felt that kind of mismatch, it's really good to be able to go through and talk about your experience and have the option to do that with someone.
Can I have a vaginal birth if I had a vaginal wall prolapse last time, and is a C-section my only option?
So like the famous midwifery line of, so in a midwife's remit, there's certain things. So basically what we'd advise you to do is discuss it with your consultant obstetrician. So you'll have a clinic appointment with your doctor, and you'll be able to go through to make a personalised care plan for you, because what the ins and outs of obstetric and gynecological history is going to make a difference as to what their kind of plan and sort of recommendation and stuff would be for you. So I'd say if that's happened, definitely contact, I don't know if that person's pregnant now or not, but definitely contact your doctor. Your midwife will be able to get you a referral, speak to the obstetrician, and they will be able to discuss everything with you, and then you'll have a plan and yeah, know where you're going from it.
I think it's the same as before. It's weighing the risks of a vaginal birth to cesarean section with the vaginal wall prolapse. You don't want to be making anything worse if that's what the doctors think may happen. But obviously understanding that cesarean section is major abdominal surgery. So it's just balancing those views and knowing what are the risks the mum is happy to take.
It is my dream job to be a maternity care assistant. How do I get into it?
You should ask.
Oh, you can answer this, Emma. Give us a break.
Well, you need to love people. Do you know what? It's one of the best experiences of my life coming and training with you guys. And I just keep everything crossed that I get to do it again at some point this year or next year, to come back, and I feel like I need to brush off the cobwebs and get going again. I loved it. Absolutely loved it. You have to do lots of training, lots of practical work, and lots of written work, and that's it.
If you look on when the jobs,
I feel like
jobs come out on
so I don't know, applying because we made a TV show and I just so happened to qualify that way. But if you're not doing it through a TV show, do you know the route that you take to apply to do that?
So the job applications go up on like NHS jobs or tracks, and you can see, actually you can download their job specifications, and the job role and thing will be on there, and it will show you what you need, like to be able to, because each unit might be slightly different. The roles are maternity support worker, maternity care assistant, healthcare assistant. They're all like ever so slightly different. So I'd say it depends on your specific trust that you're looking.
I think, like you said, Emma, it's just liking people, being in close contact with people, wanting to help, being committed to providing good care throughout the patient's experience, being trustworthy, being honest, and really just getting in, especially maternity care, you kind of see everything. And it's just like the experience of, it's not just making beds or giving baby baths or helping just breastfeeding, it's running in theatre, which is a really highly skilled. I'm a senior midwife, and I still can't do half the stuff that our girls do in our theatre.
They're so in charge.
They're so in charge. That is their domain in theatre. So, it's a complex skill, and, there's different care certificates that you can get to kind of go up the ladder, and have, be happy in the job role that you do. But we really work as a team, really, and midwife care support, we couldn't be without them, really.
Yeah, and it's very varied what they do. I mean, you can have like a specialist role in like infant feeding or supporting, or on your postnatal ward, like Joy said, if you're in, theatre or in the clinics, like what they're doing, supporting the teams. But yeah, they're like the glue that really, they are. Well, it doesn't work if you haven't got MCAs on the panic. If you haven't got them, like,
It is helpful if you can make a good cup of tea, though.
Yeah, that helps.
That tea trolley. That tea trolley. Oh.
Tea and toast just takes me straight back to hospital. If I smell toast being made in this house and I hear like a spoon going in a cup, I'm like, am I in Harlow? No, I'm at home. We've had some questions about scans. Is an early private scan worth it? This lady doesn't think she can wait 12/13 weeks.
Oh, it's so exciting, isn't it? You want to have the scans. It's just personal preference. It's up to you what you do. I think we're just mindful of telling people that the private scans are just that. It's just an extra scan. It's not a screening like tool. You're not going to get medical advice at the end of that scan. So it's just, I think if you're going to book them, it's just being really aware, like what your expectation of the scan is, and then what you're going to get, from it. And also, why do you want to have those scans? But maybe I'm picking that a little bit. as well, because, you know, if you're thinking, oh, I'm worried about baby's movements later on, or I went in and I did have a monitoring done, but I'm still worried about them, or I think I'm going to book another scan, or, you know, something later on in the pregnancy. Well, actually, we really wouldn't advise that. We'd much rather that you came in to see us in the unit. But early on, I think it's personal.
Yeah.
Right.
Personal preference.
Personal preference. I got to 10 centimetres at home by myself previously and want to do the same again. But how can I stop putting pressure on myself?
I think that's amazing that she got to 10 centimetres at home. With a second or subsequent birth, I'd be inclined to say have a home birth, really. I'd, you know, get the midwives there for you, because I think she'd end up having the baby by herself, to be honest. I think the fear is that obviously coming into hospital too early, and then having all that time kind of wasted up being in hospital when you could have been at home. But I think, especially, you know, she had a good experience last time she got to 10 centimetres. I think home birth sounds like the best thing for her, if it's something that she wants to consider. And I think every birth, every labour, every birth is completely different. And those expectations may be there, but really try as hard as you can not to have too many, because, you know how things can work out and not work out. But just remaining positive and thinking, you know, you did it before, so there's no reason why we're not going to do it again.
Yeah, get in that zone again.
Yeah.
That baby.
Yeah. In a wonderful zone. How about I got sepsis in my last labour. Does this mean I'll get it again?
No. No, it doesn't. It's a real fear, isn't it? Because I can see that would have been a really scary experience and everything to have gone through.
So unfortunate, right, that happened.
But it really doesn't make any difference to any, you know, future pregnancies or births that you have.
Okay. This lady is planning a baby, but she's scared to fall pregnant during COVID times.
Oh, that's another one that's personal preference, isn't it? It's really hard, because I think there's probably quite a few people like that who had been, you know, planning and then thought, oh, maybe I'll wait a bit, and then it just went on and on and on and on. It was like another lockdown, and then you get to the point where, well, evidently, because there's lots of people having babies at the moment that have just thought, you know what, you know, this, for me, I've looked at the situation. I'm aware that we might still be in a lockdown. COVID isn't going to go anywhere, but in what form it's in, you know, we don't exactly know. And they made that decision. So I don't think you can advise on that. No. That's just,
There's nothing, you know, telling us not to, unless obviously the only thing really at the moment is if you're having your vaccine. Your COVID vaccine recently, there's a stipulation there to wait a few months after you've had your course. But in terms of during the COVID pandemic, it is really your personal choice. Once again, it's about that risk, but really that risk, we don't even know what that risk is ourselves. You know, there's nothing that we can pinpoint saying if you fall pregnant, this might happen due to COVID. We just don't know.
We filmed delivering babies in 2020 last year during the summer. All remotely, obviously, and the women film themselves. And I thought the one thing that they would say was that they had so much fear of COVID and going into a hospital, because everything we were seeing on the TV was hospitals filled with COVID, and, you know, it's the last place you kind of wanted to end up. But as much as being fearful of coronavirus, they were also really fearful about being in hospital by themselves, because the rules that were surrounding hospitals at the time were, you know, partners had to kind of only be there in, you know, right near the very end. So, but that's different, right, from unit to unit?
In our unit, like I said, me and Gloria generally work on, you know, birth kind of setting, and then you've always had a birth partner there. So that stayed the same, because you're in an individual room. So the social distancing, that's what the key thing is with being able to birth. So different units have, you know, different layouts and, you know, different floors, like larger bays and things like that, or smaller bays. But if you're in an individual room, then you're essentially isolated from another couple. Your midwife will be wearing her PPE, the doctors will be wearing their PPE, care assistants, again, we're all, staff are all wearing that. We ask birth partners to be wearing their mask. Women in labour obviously don't wear a mask. That would be mean. So it would be problematic. I don't know, having them actually present in your experience. We've tried our best way around it. We've done what we can. You have to be safe for women and other women and families and staff, because you need the staff there to be able to look after you as well. And, we need to sort of try and protect everyone and make everyone as safe as possible. So the risk assessments are continually done around that. And, we found the best ways around it. We've got partners waiting out in the car, ready, brewing an induction or something, ready to be there the minute the lady is, going across to be in an individual room, and then they're there ready. We try and get kind of around things that way, but it's just around safety. But people have been incredibly understanding, but we understand as well that wears thin when it's your birth experience. And, everyone thinks, but for me, or just this once, or could we have this? But that's the whole thing with lockdown, right? That everyone has to do their bit for the safety of everyone else. But when it's your birth experience, that's hard, isn't it?
Yeah, it is. But as you say, the things that are being done are to keep everybody safe. The mothers, the birth partners, all of you guys who are in there all the time looking after people. So it's all done for the right reasons. Doesn't mean it's easy for you to sit there and go,
no.
But, we're living in times that nobody expected. Okay, one final one. Oh, actually, I've got two. Will the midwife show me... I just keep finding more. Will the midwife show me how to put on a nappy and clean my baby after birth?
Yes. Yes. If you need any help, then yes, definitely.
We try and encourage you to do it.
Yeah, we try and get the dads usually to do it. They're the ones that get the nice poopy nappy, the first one. That's always fun to watch. But yeah, we're always there. We'll help changing baby.
Yeah, we don't just make you get on and do it. I mean, like, you're given this, especially your first baby, like, you're just allowed to make this human, and then you're allowed to take them home, right? Like, and you're like, what? I'm allowed to look after it? Like, it's mine? So yeah, you need some help with tips and stuff, and everyone's, a little bit tentative at first. So we'll go through, there's loads of teaching stuff, but yeah, you're not forced to do things, but we do encourage people to get involved in, so that then you think, well, when you go home and you're going to be doing it, that you know what you're doing. So yeah, so just ask, but do say, because maybe if you've had a baby before, a couple of babies before, then and you're feeling a little bit like, oh, can you just go over this with me? And someone thinks, oh, well, she'll know what she's doing, and I don't want to be patronising or something. Just say, and then of course, I'll go through anything.
I remember I did a baby check on a baby when I was there, and I think it was their first baby, and whilst I was doing the check, I was like, oh, should I put a clean nappy on while I'm here? And they were like, oh yeah, right then. And the baby just started pooing, and I was like, oh okay. But it just kept, and it filled the nappy and it kept going, and there was I was just like, give me another one. It just kept going and going and going. So sometimes it's really helpful to have someone there helping you, especially in situations like that.
Definitely.
Coming out, I was like, oh my God, I need new bed sheets, I need new baby clothes, I need more nappies. There was a lot. And the last one is quite specific. So a woman is currently taking tinzaparin during my first pregnancy. Will it affect my birth?
So no, it won't affect the birth. No.
There might just be timing of when you stop taking your medication prior to birth. That might have a planned induction, just so that you time it correctly, because we wouldn't want you to be off your medication for far too long, because post-birth, usually 6 hours. As long as bleeding is okay, we start the medication again if those risk factors are still there. So it really depends on the reasons why. So really the best person to discuss this with would be your obstetric team, who you're under.
I feel like I've kept you for like a whole hour-long coffee break, which I know is not allowed.
No, it's been lovely. Thanks for having us.
Thank you for doing it. It's really nice to see you both. And I feel like I keep looking at that bath behind you going, I've cleaned that bath so many times.
Yeah, come back again, please.
That floor. That's one thing that we do a lot as an MCA. You do a lot of mopping, but it's worth it because that woman needs a clean room. Thank you so much. It's been lovely to see you and lovely to have you as part of the Happy Mum, Happy Baby virtual meetup. So thank you for your time today.
Thank you for having us.
Sending love.
Huge thanks to Disney Plus for helping us bring you the Happy Mum, Happy Baby virtual meetup. And if you like this, then there are so many more videos for you to watch and enjoy. Just head to happymumhappybaby.com to find out more. Enjoy!